and welcome to my channel, or welcome back to my channel. My name's Haley and this is Haley's Habitat. Thank you so much for taking the time to stop by. I really appreciate it. Today I'm going to be making a video all about the truths about postpartum, some stuff that you need to know about labor and delivery, and just some all-around things that I wish that people would have told me whenever I asked instead of sugarcoating things. And yeah, just some things that I wish that I would have known whenever I was pregnant beforehand. So I'm going to start off with during labor and delivery. This is going to be kind of organized. I'm going to try to be, I go off on tangents and stuff, so you never know. Okay, so if they give you the option of a peanut ball, which is literally shaped like a peanut, okay, and it's like a yoga ball, it's mushy. If they give you that option to stick it between your legs, I would do it. Lay on your side, stick it between your legs, relieves a lot of pressure, and I believe it also helped me dilate. Whenever I was using that, I went from a 6 to a 10 in 1 hour. So I don't know, and it really helped relieve a lot of pressure, and I really like that. Also during labor, well, while I was pregnant, I threw up the whole time. During labor, I also threw up because of the pain. That's what they told me, that it was more than likely because of the pain that I was experiencing. Goodness. And I did have an epidural. And epidurals, they're not, okay, I'm not going to tell you to not be scared, because if you're scared, you're going to be scared. But they're not as bad as what you think. At least my experience wasn't. I was able to hold my husband's hand, I was able to hold the nurse's hand, and she kept me really calm, and it was not that bad. My anesthesiologist, he just talked to me the whole time, and it was not bad at all. But the epidural also did make me shake uncontrollably, which can be kind of scary. It probably scared my husband a little bit, but it's actually completely normal for the epidural to make your body, and I'm talking about it makes you shake like crazy. It's not a little bit, it's a lot. If you don't want to see what's going on during your delivery, whether it's vaginal or a C-section, don't look above you in that light, because you will see the reflection. My nurse thankfully told me that beforehand, but I did accidentally look up there once, so I did see what was going on, but I quickly looked away. But yeah, don't look up there if you don't want to see, but if you do want to see, then look up there and you'll be able to see, everything that's going on. In my delivery room, my doctor, he actually had a, I don't know what you would classify him as, but he was like a student that was like training under him. And he was always there during my prenatal visits. I'm sorry that I'm sniffing so much. My allergies are literally terrible with this Tennessee weather going, all over the place. But yes, he was a student for my doctor, and he was always there for my prenatal visits, or for, my visits while I was pregnant. And he was there during delivery. And yeah, he was there, and I wasn't even worried about it. Not only was that doctor there, but there was actually a student, this woman, who she asked if she could be in there too, because, she was a student, and it teaches her, she wasn't involved or anything. But, and I said, yeah, you know what, I'm a student too, and I have to learn, so, why not? And I didn't even notice her there whatsoever. I didn't remember anybody in there, like, I wasn't worried about it. So don't worry about that, have in the room who you want to have in the room, but don't so much worry about it, because you're really probably not going to be as worried about it at the time as you think that you are. So when it's your time to push, you want to push like you're pooping. You want to push like you're trying to poop out a turd, okay? You don't want to push with your stomach. You don't want to push with your abs. That's going to do nothing but make you tired. And if you can, push the whole time that the doctor is telling you to push. Try not to stop and breathe, because at that time you don't want to breathe. I was making the mistake of doing that, and Jackson would be out a little bit and then his head would go back in whenever I would stop. Whenever you're in that contraction, if you can, just keep on pushing through it. Like push, push, push if you can, because it'll just help it, go along. Okay, so your first pee, they'll take out your catheter and then you'll have to go pee within like a couple hours. Your body you won't have that feeling, but you will need to go pee. And they'll have, I believe it's called a Perrier bottle. It's like a squirt bottle, and they'll squirt some warm water on you, and then you'll relieve yourself, okay? And they'll help squirt you off. They'll continuously help you. That bottle's also how you're gonna clean yourself whenever you go to the bathroom for the next at least 6 weeks. If you do rip and you have to get stitches, if you had an epidural and if it's still in your system all the way, then you will not feel anything but just a little bit of tugging. I did have a little tear on the side, and they don't just piece it back together and sew it up directly the same. They kind of sew it up a little bit different. So it will be a little bit different down there, but it's okay. I did not look down there while I was healing. I had a few friends. Jackson's talking. I had a few friends who advised me not to, and I listened. I did not want to scare. If you can eat before you go to the hospital or whatever, you know, if you're getting induced or whatever, if you can, eat beforehand. I stopped at Waffle House before I went and got induced, and that was at midnight. So I wanted to make sure. I was worried about my food. I did also throw up while I was pushing. So I threw up my whole pregnancy. I threw up while I was in labor. I threw up while I was pushing, and I also threw up after I had him again. So, like right after you have them, you may not feel how you thought. When they lay that baby on your chest, you may not be feeling the way that you thought that you would feel. When they laid Jackson on my chest, I loved him, but I did not cry immediately like I thought I would. And because everyone was in there and kind of like all the attention was on us, I don't know, I just kind of felt really weird. I kind of felt awkward the whole time I was in the hospital, to be honest. I just didn't feel right. I don't really know how to describe it, but it was definitely a really weird experience. I remember after I had him, you know, the nurses would come into the room. Right after I had him, the nurses would come into the room. They'd have to push on my stomach. I think it's on your uterus. They would have to push so hard, and it hurts so bad. Like I remember it would make me come up off the bed in pain. I'm not trying to scare you, but it is extremely painful. It's probably one of the worst things. It's probably one of the hardest things that I went through. It is extremely painful. It's okay, baby. And your uterus will be shrinking, and so you will get extremely bad sharp pains, but that is normal. That is your uterus contracting and shrinking back down. So the nurses, like I said, they will help you go to the restroom. They will help spray you off. Let them assist you, because you really do need more assistance than what you think that you do. So take it while you can have it. Utilize the nurses, the lactation consultants, utilize the doctors. If you have a question, ask it. Do not feel like you're bothering anyone. Ask your questions, because it's going to be a lot harder to ask questions once you leave rather than whenever you're there, you can ask them in person. If any way possible, get moving as soon as you can. The longer you sit, the stiffer you'll get. But yeah, just get moving because you need to. It's gonna be uncomfortable, but yeah, you need to get up and walk around, get your body moving. I can remember coming home, and on the days that it was chilly, my nipples would hurt so bad. They would just ache. I remember complaining to Kyle all the time, like, your nipples really go through it. Your boobs go through the ringer. I don't know if mine were more sensitive too because I was breastfeeding. I'm not sure about that. But yeah, they were extremely, extremely sensitive. And your nipples also will crack. Mine cracked within 24 hours. Lanolin helps extremely well. Take a pea-sized amount and just rub it on there. You don't have to wash it off before your baby nurses, just let them nurse. Whenever you go to walk, you may feel like there's a bowling ball between your legs, and that's completely normal. Yeah, it's extremely uncomfortable. You're gonna have a lot of pressure down there. And of course, everything that I'm talking about is for a vaginal birth. I haven't had a C-section. Oh, something that I forgot to mention also, that I wish I would have mentioned in the beginning, is whenever you go into labor, whenever you're pushing, whenever you're doing anything, try to have a realistic mindset. You want to be positive, but you want to be realistic. You don't want to be thinking that you're only going to be pushing for 10 minutes because, you know, your mom and your sister did. You never know. I remember going in there and starting to push and being like, okay, Hayley, you're about to push, but this could last for 2 more hours, and then you could still have to go get a C-section. You don't know. You know, everybody's different. You have no idea what your birth is going to be like. Another thing that I forgot is if you have a birth plan, you want to write that out and you want to let them know. Because you need to write it out on a piece of paper, type it up, give it to the doctors, give it to the nurses, give it to as many people as you can, because they don't know what you want. If you want delayed cord clamping, if you want the dad to catch the baby, whatever you want, you need to write that on there so they're aware of your wants. If you want to make sure that your baby gets no formula, you need to write that on there. Because they don't know unless if we tell them. It's okay. And with that being said, you're also in charge. You know, the doctors are there, and they know what they're doing and everything, but you know, what you do have a say-so. If you don't want your baby to get a bath, let them know. If you want your husband in there while you're getting an epidural, let them know. You know, you're ultimately in control. You need to let them know what you want and, you know, not let them just boss you around and do what they want to do. Because some doctors and nurses have your best intentions, but some of them have their own intentions, you know. So make sure if you have a birth plan, if you have things that you want, make sure that you let them know. So after you have your baby, you're still gonna look pregnant, and that's completely normal. You're still gonna have that pooch. Your body's not gonna completely snap back. I'm 11 months postpartum, and I'm still not snapped back. This is completely normal. But if you're looking to lose weight, if that's something that you're interested in, just try to eat healthier. Don't focus on working out right after you have that baby. Enjoy that time with them and really savor it because it flies by. I know if you're watching this, you're probably tired of hearing that. You're tired of people telling you what to do. But truly, I mean, you wouldn't believe it. The days can be extremely long, but I mean, this year has flown by. I could not believe that he's about to be a year old. Your period cramps, once you get your period after, they may be a lot worse. My periods are a lot worse than they were before I had Jackson. I used to have period cramps, but they were not nearly as bad as what they are now. Not saying that that is gonna happen, but there is a chance. And so once you're healing, or you know, your vag is gonna be throbbing so much, it's gonna hurt, it's gonna just be aching. And that's because all of the blood rushing down there to heal it. This is completely normal. And also for postpartum, you're gonna want some big overnight pads. You're gonna want just some regular big pads, some Tuck's witch hazel pads, or just some sort of witch hazel pads. You're gonna want, and yeah, some nipple pads. I lived in the Walmart nursing nightgowns because it's the only thing that could contain my boobs. Your boobs are gonna be enormous. I had to wear a 3X just to hold my breast. About 4 months in, my milk regulated, and I thought that I lost all my milk because I had some cushion then, but it wasn't. My milk just actually had regulated. So your first poop is probably terrifying you. I know it did me. Take your laxatives beforehand if you can, a week beforehand, because they do take a while to work, and just relax. Don't push. Just relax, let it come how it comes, don't push. And you can take those witch hazel pads and use that to wipe, and it is so much better. I use that a lot, and it really, 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 really helped. Okay, so the last thing I want to talk about is how if you have a vaginal birth, you don't want to take a bath, what's it called? spritz bath, sitz bath. What's the word? Hopefully you know what I'm talking about. You can take those, you know, those are, you're supposed to, but you're not supposed to sit down, you know, in soap and water. Sit down in that dirty water. You're not supposed to do that because you can get infections. You don't want to use toilet paper because it can get caught in your tear, or in your, you know, all of that toilet paper can get up in there. So don't use toilet paper if you have a vaginal delivery, okay? I really, really hope that this video can help someone out there. I know I didn't go over everything that I wanted to, but I've already been talking for like 25 minutes. But yeah, I hope that this can help at least one mama. If you have a question, please ask me. If it's a question about anything, please ask me, and I'll be honest if I don't know. But yeah, I really hope that you have a wonderful day, and I thank you so much for watching. And if you have a video that you would like to see, just let me know. Thanks, guys.